I think the overall biggest concern that I would highlight is this slowing progress and even reversal of progress that we had been making global health gains. And it's due to two things in my mind. First, as we did after H1N1, after Ebola, after Zika, we have not taken the lessons from the COVID-19 pandemic and really applied them. There were no fewer than four major international reviews of the COVID-19 pandemic response that made a whole set of recommendations. The biggest one was chaired by former President Ellen Sirleaf Johnson of Liberia and former Prime Minister of New Zealand. And they gave a whole set of recommendations for the reform of the global health architecture and the pandemic response that were extremely logical and extremely doable. Not one of them has been fully implemented. And so we haven't taken those lessons on board at the same time that big cuts, for instance, from the US government in the abolishment of USAID and big cuts in spending overseas are reversing progress, threatening to reverse progress that we've made on childhood immunizations, on HIV, on TB, and particularly on malaria. The impact of the US cuts on immunization rates has been significant. It's not just the United States, of course. All of Europe has scaled back its spending in terms of its overseas development spending. That's partially due to Ukraine and the increase in defense spending that Europe is seeing. But there's been the termination of thousands of global health programs that provide vaccines and life-saving treatments to millions around the world. And especially there's concern around polio, measles, and tuberculosis, three very prominently vaccine preventable diseases. And for instance, the Lancet study looked at data recently that showed that between COVID-19 and the cuts that we're going to see increasing population pressures around immunization pressures in at-risk populations around the world. This comes at a time where vaccine hesitancy globally is on the rise, according to data that's published by a number of organizations, WHO, as well as the Vaccine Confidence Project. And the recent appointment of Robert F. Kennedy Jr. in the US, who has been in the past a vaccine skeptic as Secretary of Health and Human Services, has led to major policy shifts in the US and dismissal of a number of scientific experts from standing panels with the CDC. But it's not just his appointment and those impacts. There's been cuts to research on vaccine hesitancy. There's been a general amplification of vaccine misinformation in social media that is almost impossible to police and regulate. And coming out of the COVID-19 pandemic, where two things happened, people were sort of worried about certain types of vaccines, new types of vaccines, mRNA vaccines, and others. We didn't do enough to address that in high income countries. And then the lack of access, very delayed access to vaccines in low and middle income countries meant that there was a lot of skepticism about vaccines that hadn't been there before when we were talking about years of the expanded program on immunization delivering life-saving vaccines to children around the world. So that would be my take on the biggest concerns we have and the overarching concern of this step back we have in progress on global health goals and concerns about funding for the immediate future.